dashboards, and surface level metrics to talk about what truly drives healthcare performance. I'm your host, Stephanie Dorwart, the founder and CEO of Altius Healthcare Consulting Group. Krista Bragg is the founder and CEO of KB Kinetics and author of The Startup Guide to U.S. Healthcare, Real-World Tactics and Insider Insights. She brings more than 2 decades of experience as a healthcare operator and executive, including senior leadership roles within large integrated healthcare systems. Krista, welcome to the show. To get started, if you could just share a little bit about your background, who you are, and what brought you to this point, that would be great.
Well, thank you, Stephanie. It's really fabulous to be here. You know, I've enjoyed the last few months. We've gotten to know each other and think you're very talented. So it is a pleasure for sure. I did it for many years and enjoyed keeping my toes in the clinical side. I think that's very important. I've had the privilege of working with really great companies like University of Pittsburgh Medical Center, Highmark Health, Allegheny Health Network, and Health First in Florida. And throughout my career, it's kind of like I was asked to do things and I enjoy learning. So I was greedy and took up any work that was offered to me. And through that pathway, my scope began to expand and my leadership roles increased. And my most recent industry or hospital-based role, serving as SVP operations for Allegheny Health Network, which is a 14 hospital system, around 20,000 employees. Wonderful experience there. And then last September was given the opportunity to separate from the organization and start my own company. And I've been surprisingly very busy with a mixture of operations and strategy for healthcare providers, as well as managing around a dozen relationships with startup and tech companies. So a mixture of work, but all very invigorating and interesting. And sometimes they intersect because I'm able to connect startups with companies and health systems that are needing their expertise. So it's been a wonderful year.
Yeah, you bring a wealth of experience and backgrounds to the table, Krista. And you touched upon something during your introduction that I would love to just mention briefly. Is you mentioned that you embraced all opportunities that really came your way and lends itself to the opportunities that you have at your plate as being the founder and CEO of KB Kinetics.
Right. Well, I think it takes a little bit of maybe courage and being bold, for those who are still in school or early in their careers. So I think having the courage to step forward when you don't know all the answers and bring the brilliant people around you who do can be really helpful to you as a person and also for your career.
Yeah, and it's really a sign of a great leader as well, because in leadership, it's important to understand your strengths and your weaknesses and surround yourself with individuals that have the talents and experience and expertise that maybe you don't. So in your role with KB Kinetics, you've worked inside healthcare systems, you've worked with payers, you've worked with tech companies, you've worked with large healthcare organizations and environments. And now you're really taking on this role as advisor and founder. And so from all of those vantage points and from your experience, where do you see that healthcare organizations really struggle with the execution, even in your background, as a hospital leader? What really gets them stuck?
Well, I think sometimes they overwhelm themselves by having too many priorities. And the one, it's easy to read a paper or, a benchmark or a KPI and think that your team is way off because they're not matching those numbers. But if you don't understand the workflows, whether or not they're efficient, the hassle factor, I'll give you a great example. Working with an organization, and Stephanie, I think you have probably even seen this for sure in your business. Working with an organization, not understanding why their throughput is so slow from the ER, right? So they have, like many hospitals do. I talked to a hospital last week in Florida. They have anywhere from 100 to 150 boarders a day. Those are patients lining their halls of their ERs because they can't get into the units because there's no capacity, right?
Yeah.
Well, in some of these organizations, we have odd workflows, such as the nurse taking the patient to the lobby for discharge, and the nurse is with the patient in the lobby waiting for their ride for 40 minutes, unable to do their work on the unit. That's a simple thing. That workflow being allocated to a nurse versus a transporter or even a nurse's assistant. But the ripple effect of that just impacts the entire hospital. So I think really understanding the work and whether or not the workflows are streamlined and as ideal as possible really impacts how you view the productivity of the department as well as the strategies that you're putting in place.
That's a great example, Krista, and I'm going to build off of that a little bit, especially with all of the situations that I'm sure you're hearing about right now. You just mentioned the hospital in Florida that we're hearing about, with borders piling up in the emergency department, inability to get the patients up on the med-surg floors, or even to discharge the med-surg patients.
That's right. Exactly. Another quick example, which is a real one. When I was out west recently, I toured a unit at 3:00, around 3:00, which is shift change typically for the nurses who work 8 hours, right? So on a med surg unit, it's around 3:15, and there are rooms that are empty. So there are patient rooms that are empty, that no patients in there. The bed has not been cleaned. It's still dirty. And there are patients in the ER really wanting to get into a patient bed. And the issue is they didn't have a secretary or a unit clerk. So the nurses were so busy, they didn't have time to call or to indicate an epic that the bed was empty and available to be cleaned. That simple act alone just backs up the whole flow and the throughput. It can impact patient safety. Certainly it impacts the nurses, joy in work, because they feel like they can't get caught up or they're feeling like they're behind all day. So understanding the work is pretty important when we're developing the strategies and trying to make improvements.
So we can go back to, not only your experiences currently in your current role of supporting the hospitals, but back into your hospital executive leadership roles. When you were looking at all of the opportunities and the priorities, and even whenever you were interacting with consulting companies or others, how did you decide where to focus your operational priorities? What did you do to determine those 2 or 3 levers that you had to choose at that particular point in time? Because I think that's really important right now. I hear the words overwhelm. We don't know where to turn. We don't know what to do next. We're defeated. We're burned out. We don't have any resources often. So what should operational leaders do to really focus attention on what truly matters?
I think it takes a little bit of time and preparation to get organized around that. So bringing the right people around the table and working through what exactly are the problems that we're facing. If it's a throughput problem, working through operational excellence, 5 whys. Why is there a throughput problem? And really understanding that. Hospitals that do really well with throughput tend to have nursing units that are able to pull the patients from the ER instead of the ER trying to, sort of push the flow into the hospital. So really understanding what the problems are and then working together with, the people that are leading the work and doing the work at a closer point to map it out. We've done many times, we've mapped out that Eisenhower grid of, urgent and important but not urgent, because sometimes when we're gathered around in a morning huddle and you could feel the tenseness because people are overwhelmed. Sometimes a breakaway session where we just put it all out there and put it on the grid can really give people some clarity on what's the real issue that needs solved today versus the background noise that's stressing me out as a leader but does need to get resolved, but maybe just not today. So pulling the right people around the table, really understanding what the issues are, because sometimes we assume the issue is something else, really understanding what the problem is and then sorting it and arranging it so that it can be prioritized.
And you mentioned the Eisenhower grid, and I think that's truly important because whenever everything seems urgent and every time that you're looking at something, you're putting a fire out, it's really difficult to respond as a leader to what truly needs to happen. And it's a simple way for your team to just, as you mentioned, put everything out there on the table, look at what the true issues are, and then really respond to what's urgent in that point in time and realize that the rest of it can fall away and you don't need to respond to everything quickly.
Right. That's right. Yeah, I think from a practice and process perspective, talking to the people doing the work can be incredibly enlightening. I shadowed some nurses in a pre-op area recently in a hospital. So, For those who are newer to healthcare, the area that you go to before you go into the operating room, and the nurses are prepping you and you're talking to the surgeon, you're signing your consent. And the nurses were very, harried and stressed. And when I kind of followed them around, I noticed they kept leaving to go to another unit to borrow their bladder scanner. And then they were leaving their unit to go somewhere else to borrow someone else's ultrasound to put the blocks in. So those little hassles, those little breaks in their flow in which they're leaving their work to go somewhere else to track down equipment they should have, that was very impactful, because it was, the surgeon had to wait because the bladder scanner, procedure hadn't been performed yet, or the OR team is standing there waiting to get going because the block is not completed by the anesthesiologist or CRNA because there's not an ultrasound available. Those two pieces of equipment, those were recommendations I made that day to that C-suite that they purchased right away. Those two things alone made a really big difference for the group. So talking to the people doing the work, they can tell you, the people who are taking care of patients have great ideas. And I do think, in my experience, sometimes leaders become so engrossed in their own day-to-day work that they miss the input they can gain by being on the units and really talking to the people that are doing the work. That's so incredibly impactful. They always have really good ideas.
They do. And, everything adds up to that productivity leakage.
Certainly there are new government subsidies that are coming out in 26 that will be helpful. But a large percentage of hospitals across America are in the red. They're not generating income, and they're starting to close units. So we worked with a hospital out west this past year, and unfortunately they had to close their OB unit because it was just, they were losing so much money. It was unsustainable, even though they really wanted to continue providing that service for the community. So right now, with these, financial headwinds relating to productivity issues, agency staff, agency nurses, CRNAs, outsourced physicians, all of those experts cost premium dollars. And all of that added together, along with reimbursement changes, which tend to decrease more than increase, are really impacting the bottom line for hospitals that really never made a lot of money, especially the not-for-profit ones.
Yeah, absolutely. Especially for the communities that, live within those markets. So it's a really interesting time, and hospitals are being, forced to explore a lot of different payment models. And I wanted to shift and talk a little bit about value-based care and the change management around that. I feel like we've been talking about value-based care for decades now, and we're still not quite to an environment where we're fully value-based. We're sort of shifting beyond fee-for-service. There are more and more value-based programs coming in. Medicare has some mandatory programs with the teams-based approach, the team approach that's coming up this year. Mm-hmm. What operational mistakes have you seen, do you see with your clients in your past as organizations work to make this transition?
Well, it's going to be a challenge for anyone, for any group that's trying to make the transition, just because incentives are so misaligned. For example,
so
right? So we met with a physician in a large academic center a few months ago to present this AI tool. I know AI is the term of the day, but long story short, would help patients from being readmitted after surgery, right? And the surgeon's response, and he's the chief of the group, said to us, "Why would we ever do that? We need all the volume we can get." Right? So we have this pressure to generate volume, to have increased patients in the hospitals to help drive their margin. We have insurance companies that are trying to spend less on patients per month from a medical spend, who are very motivated to keep patients out of the hospital. And I think with good intentions, I think that people have mixed thoughts about insurance companies, but ultimately for the patient, if we're able to keep you healthy and you don't need healthcare, then that's, to me, is a good thing. But I think that the one organization that I've seen that's really making this work, they've gone through the process of redesigning their physician contracts to be based on quality outcomes instead of RVUs. You have to change the incentives to allow providers and organizations to function in a way that meets the value-based care requirements. So it's a challenge.
Yeah, it absolutely is a challenge, and it definitely answered the question.
One really great side effect of all of this conversation we're having right now is I think that hospital leaders are being forced to look closer at their operations at a deeper level, which isn't to say that they weren't before, but now there's a new lens of really trying to understand the impact of, when we don't have enough transporters, how does that impact the entire house? Because it does. It will impact the
Mhm.
radiology, productivity, all those groups you just mentioned.
Yep.
Or, what about the period of time in which we have, half of our food and nutrition workers out for whatever reason? That's very impactful, and it impacts everybody in the hospital. So it's easy maybe to focus on just a nursing unit, to your point, or just the ER, but the global picture of, where are the bottlenecks? And it's usually processes, it's not people. I do believe that most people go to work, they want to do the best they can for their patients. A lot of people find joy in their work, and the items that detract from that are hassle factor, inefficient workflows, and all of the things we've been talking about.
I 100% agree, especially in healthcare. The majority of healthcare workers, regardless of the department that they're working in, they were brought to their organization because of their passion to want to make a difference and want to make a difference for others every single day of their lives. So it's really that service mentality that unites all of us that work within the healthcare spectrum together. And through that lens of change management and the effective things that we need to address and change, I think there's a huge opportunity that we can all do in the future, and that excites me beyond anything right now. And I do want to touch upon, some of that innovation, because I know you're in a unique situation and role where you get to work with startup companies, and you already mentioned AI tools, but you sit in a position where you see a lot of innovation that's possible and tools that are coming to the forefront. So within, that role with the startups, the innovators that you're working with right now, what are some of the tools and strategies that are getting you really excited about what's to come?
I think a really great example of AI enabled operations that have been impactful, if you look at the company Abridge, if whoever's watching, if you haven't read about Abridge, ABRIDGE, you should. Created by a cardiologist, and Abridge created an ambient listening product for physicians to use so that when they're taking care of patients, they can actually take care of patients. Great example. I went to my PCP recently. I love her. I really enjoy my PCP. I hope most people do, but I really do like her. She asked for my permission if she could record, and she just dropped her phone on the desk and we just talked. And in that conversation, she's looking at me, I'm looking at her, and we had a great conversation. And the Abridge ambient listening picked up our conversation, created notes for her in the chart so that she only had to review them and sign off. They're accurate, they're not, they're missing something. And then she moves on to her next patient. And what she said to me is, since they've started using that ambient listening program, she's been able to decrease her pajama time, as the physicians call it, meaning in the evenings, she doesn't have to be on her computer after her kids go to sleep for 2 or 3 hours documenting her work from the day. She's able to spend time with her family. So from a joy in work, which can really improve productivity because that time is, not spent documenting, it's spent being a physician or being a healthy human being. I think that type of technology and innovation is very impactful. So we're working with another company called Relayd, RELAYD, and Dr. Chawla is working with nurses to build similar types of technology for nurses, for inpatient nurses, such that handoffs can be generated automatically. Nurses can give, report through a QR code, and the list goes on and on. It's phenomenal the way that technology might really improve workflows for nurses.
Yeah, I definitely agree. And you provided two great examples of companies, Abridge and Relay, that can really help to do two things. One, decrease the burnout and stress that the providers and clinicians and staff are feeling about everything. And we're sitting in a period of unprecedented turnover right now in healthcare. So everything that we can do to make the work joyful and make the work meaningful and take away the stress points, will help us retain great staff members and great providers and great clinicians.
That's right. That's right, because understanding the financial impact is important to making all these decisions from an ROI perspective. But to the point you made about a bridge, the other advantage for technology like that is perhaps another patient can be seen in that day, right? Maybe
Yes.
the schedule can be enhanced with an extra appointment, which means access. So
Yes.
not so much even productivity, but just about taking care of that person in the community that needs to see that physician, but has had to wait 2 or 3 weeks. If they can get in sooner, are we able to prevent their issue from becoming worse and them needing increased medical care? So there's definitely a profound impact to addressing those workflow issues. And Relayed, some of the pilot data shows the use of Relayed can decrease a nurse's work time 1 to 2 hours a shift. That
Wow.
is unheard of, right? So, and it's customizable. So each unit can make it, solve the problem that they're looking to solve. But those are the types of AI-enabled operational improvements that are going to make a difference. We hear people talk about AI all the time, and they talk about AI even in healthcare, but I don't see a lot of connecting the dots between the technology capability and the real problems, which are not always so fancy. Sometimes they're simple problems that AI technology can solve. So it's exciting to see companies like that are really embracing the reality of the work and able to provide solutions that are effective.
Yeah, that's definitely exciting when you think about it from the lens of access and you approach it from being able to get 1 or 2 more patients into every provider in every clinic on a day-to-day basis. You can really influence the amount of time it's taken. Right now, if there's a 3 to 6 month wait time, and you start to leverage that, you might be able to get that wait time down to 4 to 6 weeks or even closer, because ultimately you want to be able to see the patients as quickly as possible. And
Right.
access actually influences staffing effectiveness. It influences productivity and influences quality outcomes. And all of those things definitely relate together. So in the role of technology and enabled solutions, what might be some challenges or red flags that you see when hospitals start to deploy AI or start to deploy technology? What do you see that suggests this leadership team is going to struggle with this decision or struggle with this implementation?
Without fail, or I would say when we don't include the people doing the work. The
Yes.
worst thing in the world is to adopt some technology that impacts nurses' workflow and you haven't included the nurses. I'm flummoxed by the idea that anyone would ever do that. One organization we worked with last year initiated this really large diabetes prevention project, and they failed to include the endocrinologists because it was all PCP driven. And I mean, ultimately, when it's easy to see when you're the outsider looking in because they're busy trying to solve their own problems, but you have to include the people that are doing the work. If you don't do that and you try to implement something, it's going to fail without a doubt.
If you're not involving the nurses, the providers, the clinicians, there's going to be friction in that decision because they weren't at the table. And even when we're presenting with productivity and workforce optimization and those large products, I'm still surprised at times by the lack of involvement of certain groups of leaders within the organization. When you're looking at steering committees, you're looking elsewhere, you need to make sure that those groups are well-rounded and that you're pulling in individuals that represent everyone within that group.
Totally agree. So really understanding the work that's underway now and how that technology can plug into that is really helpful.
I think that's great advice to understand when you're evaluating new technologies, or if you're a startup, how you can make your solution as seamless as possible. And I love the term that you said, the plug and play, because when it's plug and play, your time to execute and actually bring that into the organization and allow the leaders to actually implement it is going to decrease. And that time, again, is access to care. That time is money. That time provides better outcomes. And anything that you can do to shorten that cycle is huge. So I want to touch a little bit about your book, because it really led to you deciding to write this, what I would consider a guide to everyone that wants to work within healthcare, either on the provider side or as a company and startup.
Well, my idea about this actually started a few years ago, although I didn't realize that's what it was. It was percolating in the back of my head. A lot of people think they understand insurance. A lot of C-suite CEOs, COOs, CNOs in large health systems feel they really understand insurance. I thought I really understood insurance until I worked in an insurance company, right? Which was extraordinarily enlightening, one of the best things I've ever done in my career. But I started to think a few years ago of, why don't we know this? Why isn't some of this operational workflow and sort of behind the scenes knowledge shared more broadly with healthcare leaders? We probably could have better relationships with our contract managers, with the payer groups that we're working with. And so I started to collect information relating to insurance first. That's kind of how it started. And then it evolved into hospital operations when I would have conversations with really large vendors when I was with my last organization. And the very large vendor was bringing forth, 10, 12, $20 million proposals for us without understanding the work. And so I felt like I was educating them offline of, you need to consider this or that, and then come back with a different lens and make sure your pitch is matching what our problems are. And then the final kicker for me was about, I would say 14 or 15 months ago, I had one day, 6 different unrelated startup / tech companies I had meetings with that day. And each of them, they were repeating the exact same thing. One of them was taking a 70-something slide deck to a large academic health center the following week to meet with their C-suite. And slide 10, I'm saying to them, I know what you're selling, but I don't know what you're selling. So we revamped their entire pitch and their approach. So I think, and even yesterday, I met with this brilliant young man who has this really good idea, but probably Epic's already working on it. And he's spending all of this energy and time and money on a solution that might not need to be solved or is already being solved. So I thought that perhaps I would just start making like little cheat sheets, and then it turned into chapters, and then it just kind of blew up into this 700-page book. But the feedback I get from students, from CMU students even, who are in their entrepreneurship program, is this one chapter was so impactful to them. It helped them change significantly their approach, their idea, etc. So the idea for this particular book is not necessarily to read it front to back. Kudos if someone's willing to do that. But the idea is more around the life cycle of where you are in your training, or where you are with your company, and how do you pull out the pieces that can be helpful to you right then that'll help you move faster until you're in the next phase, if that makes sense. And the biggest difficulty with that book is I really was thinking of the non-US based startup when I wrote it. So some of the clients that we work with are based out of Portugal. One is in Nigeria, and other companies. So I really had to strip away metaphors, like bottom line, and all those different ways that we might use business lingo to make it as readable as possible. And I think that took quite a while, but I do think that helps students who are not really familiar with healthcare to understand some of the concepts. That's the feedback I've gotten.
Yeah. Another thing that's fantastic about the book for anyone that's interested in how to interact with C-suites and, hospitals from the vendor perspective is there are questions that are most likely going to come up during those conversations with the chief human resources officer, with the chief medical officer, with the chief business officer, with the CFO. And that's also a great perspective to understand all the different angles that the different leaders within the healthcare organization might be looking at. Looking ahead, if you could really look into the crystal ball right now, and I really believe that 2026 is going to be a year of rapid change within healthcare. We've already started to accelerate the change that we see per year with the differences in preventative medicine, the changing of the payment structures, what we're focusing on, within a healthcare and human, services department level and regulations. If you could really look through the crystal ball, what would you advise healthcare system leaders or hospital leaders to focus on over the next 12 to 18 months?
It's probably twofold. One is keeping, the eye on the day-to-day management of patient care and ensuring that, systems are as smooth as they can be. Certainly, I think the difficulty is sometimes for leaders that are really busy, how do you focus on your long-term strategy when you have 100 patients waiting in the ER for a bed, right?
Yeah.
Trying to find that balance. I actually met with a CEO of a large health system on Monday, and he said, he makes it a point that he has time every day to step back and look at the overall strategic approach of the organization, that he refuses to allow his day to be filled back to back to back with meetings because, then too much time passes and they've lost their way. So that saying that's so common, strategy without implementation is a pipe dream, and implementation without strategy is just chaos. So for leaders, the next 12 or 18 months, I think it's going to be really important to divide time and make sure that time and effort is allocated towards this longer term strategy of access, growth, understanding your market, making sure that services are matching your market. And sometimes it takes, the exercise of going through the services that are being offered and making sure the market still needs them. One of the first signs of that can be if you're losing money on a particular set of services, there really should be some investigation into why is that? Is that something that is even needed anymore? And, as the markets change, as populations change. So dividing the work into the day-to-day management, but then making sure that there's allocated time for the strategic planning.
Those are two great pieces of advice going into the next year. And with schedules, I love that advice. Audit your calendar.
Yeah. And I'll even add to that, in my last role or last few roles, within senior leadership at large organizations, I would work with my direct reports to review our goals. We all have annual goals that are a drive from our overall strategic plan. And we would go through our calendars to make sure our meetings and our time spent were matching those goals. Because it's really easy to have a lot of other people control your day because they're filling your calendar with their goals and their needs, when you have to make sure that you're meeting your commitment to the organization. And sometimes that exercise of simply looking at the goals and comparing the hours that you have in your week and what they're being allocated to, if there's a mismatch there, that's not good for the organization or for patients, and there needs to be a better realignment. Simple exercise, but it can be really impactful.
Simple exercise, but it makes a huge difference in focus and outcomes. So we have covered a lot of topics, Krista. Is there anything that you were thinking about leading up to this meeting that we haven't talked about that you would really like to share with the audience?
I think just making sure that you are involving the people that know the work and understand the work in your problem solving. The book that I was going to recommend if we got to that point was The Multiplier.
Oh,
I have learned from everyone that I've worked with, not to use a generalization, but I've learned which doors are unlocked in the hospital and leaving us at risk by the housekeepers, right? Everyone who's working in your organization has a lens, a viewpoint, an idea, an opinion. So being accessible, encouraging, creating a culture in which thoughts, concerns, and ideas can be brought forth to you, I think is extraordinarily impactful and powerful, and can make a good organization great.
It's great advice.
Let me just add to that. When you think about how people bond, how human beings bond, or how teams become high performing, it's by solving problems together. So embracing that culture where you're inviting people to help solve problems with you, instead of thinking as the leader, you're the one who has to figure it all out. That's just very powerful. So I just wanted to add that. Thank you, Stephanie.
No, that's fantastic. Championship teams get in the dirt together and they get muddy.
That's right. Exactly.
So if anyone, found anything interesting here, how should the audience, contact you? What would be the best way for leaders, students, and others to really connect with you?
Probably through our website. So my email address or our work email address is kbragg, KBRAGG, at kbkinetics.com. So our website, kbkinetics.com, it's an easy way to get to me as well. I'm on LinkedIn. Krista Bragg, and would love to get feedback and would really appreciate people reading the book. Again, not because of any kind of income that's being generated, but I genuinely think it's going to help people, whether you're a student, a leader right now, even in healthcare or insurance or a startup or tech company.
I agree. And at the very least, whenever your friends ask you, why is healthcare so broken? And, why is the payment system so messed up? This book will help you articulate your response a little bit better.
I hope so.
Yes, absolutely. Krista, thank you for bringing such a grounded and such a practical perspective to this conversation. Your ability to connect with all levels of leadership within the healthcare systems and the hospitals is remarkable. And it's truly and exactly what healthcare needs right now. For everyone listening, Krista's work at KB Kinetics and her book, Startup Guide to U.S. Healthcare, will be linked in the show notes. And she also shared how you can actually get copies of that. And if this conversation helped you think differently about staffing, about leadership, about execution, about how to influence change within your healthcare organization, be sure to subscribe to Beyond the Benchmarks. Until next time, keep leading and let's work together to move beyond the benchmarks. Thank you for joining.